COVID-19 in March of 2020. My symptoms included pure exhaustion, not just being tired, but pure exhaustion, a cough, a horrible cough, chest tightness, shortness of breath, a terrible headache, wheezing. So I was sent to physical therapy because I have a physically demanding job. So I was sent to physical therapy to get back where I was. I found it very difficult to even walk across the floor or across the room without being short of air. So I was sent to physical therapy to get back to a physical level where I could actually be capable of doing the job that I once was able to, and even just living life. And the great thing that KORT did for me, and my physical therapist Daniel did for me, is he would use the O2 stats to show me that I could breathe, or I was getting air, when I mentally did not think I was. So it was probably about a month in that I could actually do things, and then it was 3 months and I was back where I was. Maybe not 100%, but I was pretty close to being back where I was.
So I started seeing Holly in May after she had symptoms pretty much all the way through the month of March, and then kind of a period of a month just trying to recover at home a little bit. And when she first came in, it was one of the first patients that I had seen post-COVID. It was pretty early on, and so it was something that we were still obviously learning about. We're all still learning about. But the biggest thing that we needed to work on was just her endurance and strength ability. And then, as she mentioned, we also needed to work a little bit on giving her some confidence that she was getting enough oxygen in. And that's where I think our recovery and reconditioning program for people can really be beneficial, is to help in that side of things. We devised a plan where we would work on cardiovascular endurance along with strengthening, and continue to monitor her vitals, specifically her oxygen levels and heart rate responses.
Prior to physical therapy, I had a hard time just picking up my son. He was just 2 years old. I could hardly pick him up. Walking on a treadmill was difficult without having issues breathing. Walking a flight of stairs. Those kind of things were extremely difficult for me. So we worked on both. We worked on muscle strength, and then we also worked on the the endurance part as well. So both things were great, but it was good to be pushed here. And then when I would go home, I knew, okay, if I did it at physical therapy and I had air, then I was going to be okay at home. So that was really the peace of mind for me.
So Holly was one of the early cases that we saw in our recovery and reconditioning program at KORT, and we feel like had a very successful outcome, and I think she would agree with that. But it's a program that we just really encourage you to share with friends and family. We're all seeing more and more people impacted by COVID, and a lot of people don't know that they can get help afterwards. A lot of it is rightly focused on just getting through the initial parts of symptoms and making sure that people aren't in hospitals and get off of ventilators and all of those types of things. But there are a lot of patients out there that could really benefit from our program to help them get back to living the way that they want to live. And so we just really want to get the word out that we have this program available to help people return to prior levels of function, to return to work, to not have that fear that they're not going to have enough oxygen to do the things that they want to do. And we just really encourage people to share that message so that we can get that out and help people return.